So, we've got a quorum for the committee, Councilman Rader and myself, and as well as Councilmember Schachtner and Councilmember Baker, sorry, and distinguished guests. So first, I'll move to approve the minutes of the Health and Human Services Committee held October 23rd. Motion's been made and seconded. Any discussion? All right, all in favor? Aye, and that passes. So now we are on to Resolution 2023-44, a resolution to take effect immediately, receives the affirmative vote regarding the Cuyahoga County Health District and provide vision of health services by our Cuyahoga County Board of Health. And we are joined by some great guests, including Director Harris. So would you like to introduce your team for us, please?
Yes, can you hear me okay?
Yes, we can. Thank you.
So first, I'd like to introduce my team. My name is Roderick Harris. I'm Health Commissioner for Cuyahoga County Board of Health. And with us here, we have Margaret Case, who's our Food Safety Inspector for Lakewood. And we also have Brian Athey, who's our District Sanitarian, excuse me, and he'll do some of the other work that's not food regulated. We have Suzanne Rush. She works in our community, our environmental public health section, and we have Kevin Brennan, who's our communications director.
Forgot to turn my mic on. Thank you so much for being here. And I also welcome Director Vargo and Director Jasel. Every time we have this contract come up, we just kind of like to touch base with our County Board of Health and get a chance to hear about all the important work you all do to keep our residents safe. So I know you've got you provided some great handouts for us, and I don't know if you want to kind of talk us through some of that information or give us a few highlights.
Sure. So what you have in front of you is our annual report. That's the green document. And we also have a list of our health department programs. They're broken up into the service areas that are our divisions at the health department. And so you'll see a big list of programs that we offer. And we'll speak to a few of those today as we speak to the alignment that we have with our Community Health Needs Assessment and the Lakewood Community Health Needs Assessment. So I first like to start by introducing myself because this is my first time here at the Lakewood City Council meeting. And again, my name is Roderick Harris. I'm a Cleveland native. I've been born and raised in Cleveland all my life, but I did live in quite a few cities around the country as I, grew in my public health career. Most recently, I was in Pittsburgh, Pennsylvania, as the Deputy Health Department Director there, and I've been in this position here at CCBH for about a year and a half, and so it's great to be in my hometown and doing some of the great work that I've done in other cities here in my hometown of Cleveland and surrounding areas. I also will say that I am a former sanitarian from CCBH. So I worked here in 1998 and 1999. And during that period of time, I decided that I wanted to be a health department director. And I went back to graduate school and, like I said, worked in many places around the country. And it's just great to finally have this dream job of being the CCBH Health Commissioner. Lastly, before I get into telling you more about the organization, I will say that things might be a little different with a new commissioner. Everyone will need to get used to it, including my staff. But I would say my core values really lie around equity, accountability, and collaboration. And so you'll see that we do a lot with the City of Cleveland Health Department to make sure that we're all leveraging our limited resources to serve the residents of Cuyahoga County. But also, we're going to really look at equity and make sure that everyone has equal opportunity to be healthy in their communities and in their homes. And so we have a new Equity, Diversity, and Inclusion Director that I hired about a year ago. And so his work is really devoted to making sure that we address the interests of marginalized groups, whether that's the African Americans in our community, or even our LGBTQ population, or those with limited disabilities or limited abilities. And so we want to make sure that that is core of some of the work that we do. And the accountability piece is very important because we are doing our best to be the best stewards of tax-paying dollars. And so making sure that we're evaluating our programs regularly and making sure that we're being mindful of our budgets is very, very core. And also seeking additional funding when necessary to address many of the gaps that we might see in some of the services that we're offering or that some of our partners are offering to make sure that we can be as supportive as possible. So to talk a little bit about CCBH, I will say that we have about 185 employees. Many of those are located in Parma, which is our main headquarters. We do have several employees who do work from home, which are some of our nurses who are doing homebound services. We have 4 service areas, which you'll see on the handout that I provided you. The larger programs are our nursing and clinical programs, and also our environmental health programs. The Cuyahoga County Community Health Needs Assessment is what really guides our work. We have a community health needs assessment that we completed last year, and right now we're working on our community health improvement plan. But much of that guidance comes from those plans and also our state health improvement plan, and those have informed our strategic plan at CCBH. We just wrapped up our strategic planning retreats over the summer, and those strategic plan goals are currently being mapped out with objectives and tactics, and that should be finalized by the end of this year. One of the things that I did notice is that many of our priority needs that came from the Cuyahoga County Health Needs Assessment really aligns with the Lakewood Community Health Needs Assessment. 3 of the Lakewood prioritizations are health care access and quality, built environment, and social and community context. I think those align very well with all of our priority needs, which are behavioral health, accessible and affordable health care, and community conditions. Now, I'll talk just briefly about some of our programs that link to those, but you have, again, the list in front of you today. So for behavioral health, we do have a grant from the CDC. They call it Cooperative Agreement, but it's an OD2A, and that stands for Opioid Data to Action. And it's a grant that really focuses on how can we get people naloxone or Narcan, which is a common name for the drug, in case people are overdosing in your communities, in your homes. We want to make sure that that naloxone gets out into the community in as many ways as possible, whether that's through outreach, whether that's through our clinical services on site at our clinic where people can come in and just request it. Another piece of that work is also fentanyl test strips, so that if individuals want to test anything that they may be using, they can go ahead and have a safe way of testing those products. Ultimately, we want to prevent people from using in the first place, if possible, but at the same time, we need to make sure that people who are using or misusing have equal opportunity to enter recovery and to survive. The second priority is accessible and affordable health care. And I want to make sure that people know that the health department, we do have clinical services, but we do not provide primary care at our clinic. What our clinic is used for primarily are reproductive health services, STD, STI testing and treatment, and also vaccinations. As you may have seen during COVID, we had vaccination clinics, we had points of dispensing out in the community, we also had points of dispensing in our location out in Parma. But that pretty much will tell you a little bit about our clinical services. But we also have support services such as our Ryan White program. And the Ryan White program is primarily focused on individuals who are living with HIV and making sure that they have equal access to treatment, but also support services, whether that's housing, clinical support, dental services, anything that they may benefit from to help them live a long and thriving life with HIV. A couple of other things I wanted to make sure I mention here would be around our disease investigations. So if individuals, whether that's a foodborne illness or even if it's an STI, we do have investigators at the health department that will reach out to these individuals and try and find who their contacts are. So similar to COVID, if someone has an infection, we want to find out how we can keep that from spreading. And so we have been doing this for decades at the health department, but that's something that we really are prideful of and make sure that we invest in those teams even beyond COVID. And then lastly, community conditions. And so We really think that that's really around how can we make sure that communities have a safe environment, whether that's the built environment or whether that's even going out and having a safe place to work, live, play, exercise, etc. Violence prevention is very near and dear to me, and I know that you're aware of CCBH's work here with the basketball courts, but we've also done some work in in Euclid as well. And violence prevention, even though we don't know exactly where we want to go with the health department in this space, we do know that people need data. And one of the things that we've been focusing on is a homicide dashboard and really working with the medical examiner's office to do the best job we can to provide information to residents about what the homicides might look like in their areas. Sometimes people don't even know that shootings are taking place in their communities, but also they don't know how they can use this data to write grants or even to advocate for safety regulations, any kind of gun policies that they might be looking at. But we want to start by providing that data before we start looking at programs that we might also implement at the health department. A couple of other grants that we have. We have one grant that's coming soon from the EPA. Hopefully we'll get that notice of award in the next week or two. We were in communications with the EPA recently, and that is around health impact assessments and really equipping residents with tools to come and talk to people like you to talk about policies that they think might be important, or if they want to chime in about plans or developments that you have in mind, that they can be at the table and be involved in some of those decisions from the beginning. And so we feel like that is very important to empower our residents with. And then lastly, I want to talk about our AmeriCorps program. We have been recently, as of, I believe, October, we're a part of a NowCorps program, which is Northeast Ohio Watershed Project. And with this, we have 2 AmeriCorps volunteers who are looking to do community engagement and really go out and talk to residents about climate change, climate action, tree planting projects, getting volunteers to participate in stream cleanups and things like that. And so I think one of the things that we really realize is that people in these communities don't really know what the health department does. They might not even know that we're different than the City of Cleveland Health Department and that there are 2 health departments out here. So some of that might be intentional because Dr. Margolius at the City of Cleveland and I, we do work very closely together, as I mentioned earlier, but we also want to make sure that residents know how they can get involved. We want to make sure that they know all those services that you see on the list in front of you and know how they can access these services. And we're also looking, as a part of our strategic plan that is being drafted, as I mentioned, looking at how we can increase our access points, because we're located in Parma, but we serve so many residents all over the county, and so we need to make sure that, again, people have equal opportunity and access to obtain services from us and from our partners. And lastly, I'll have Suzanne jump in to talk a little bit about the programs that you are more familiar with, which are our environmental public health programs. As I mentioned, we have our sanitarians here who work with our food program, but also our other district services. And Suzanne has more of the numbers that you might be interested in about the magnitude of the work that we do here in Lakewood. So unless you have any questions for me, I can turn it over to Suzanne. Any questions?
Council members, anyone have follow-up questions to anything thus far?
No? Okay. Thank you.
Thanks. All right.
Thank you, Dr. Harris. Madam Vice President and council members and distinguished guests, we're very, very happy to be talking to you today. And I have to give all the credit to my partners down at the end of the table who are here every week working in your community. When I actually looked at the numbers, and I didn't run these, we have informaticians that do much better at things like that than myself. I do a lot of the community engagement, and I work in your city regularly, but not like these 2. I have to compliment Brian and Margaret. We saw tons of numbers, and we want to share a little bit with the environmental health programs that we work every week. Food protection, you know about. Any of the food operations in your community, if they sell food, whether it's a gas station, a bowling alley, a restaurant, a school, if they sell food, we inspect them. And Margaret handles the bulk of those lifts, and she does a great job of it. So we're in about 287 facilities per year, so it's quite a few. When we talk about the number of inspections, those goes up radically. Now in 2023 so far, we've done 390 inspections because we're only about a little over halfway through our licensing year. It runs from March 1st to the next end of February. So we're right in the middle. We just passed September 1 was our halfway point. So those will continue. But on average, we do about, 600, 650 inspections between illness investigations and food operations, complaints, and actual routine inspections. We're kind of busy. We're kind of busy in the city of Lakewood, cranking out numbers. And when we move over to our district sanitarian, which is what Brian Athey does, and he's really a five-tool player. How many years, Brian? 20 years. So we're talking about a veteran that you have. And Brian's worked in our urban communities and our more rural. He's worked in cities. He's what we call a five-tool player. The kid can do anything. He's fantastic. And if you don't know him, meet him. He's also a karate expert. So if you ever need defended, when I have to go to a place that I'm worried about, I bring Brian. He's my muscle. But he does the swimming pools, of which you have 34 licensed swimming pools. And that equals a lot more inspections and re-inspections because Brian's really on it as far as if it isn't safe and he wouldn't let his family members swim there, your families are not swimming there, just like Margaret with the food. We make sure that they're safe, they have the safety equipment that's necessary, the water quality is where it needs to be to swim safely because we know waterborne illness can be life-threatening. We want to make sure it's a safe environment. To give you an idea, in 2023, we've already done 103 inspections. And that's a little more than average because Brian's doing re-inspections when he finds things aren't up to par, and he makes sure it is. We have 18 schools licensed in our area for food operations and the actual school environment as well. So the actual interior of the school, classroom by classroom, corridor by corridor, is checked by Brian or another team member. And just so you know, there's always overlap. We have people that work in solid waste, that work in watershed protection, that work in food, and work in district. You have a sanitarian assigned to each of those. But somebody like Brian, who's been here for a minute, can cover all those things, and Margaret's working her way that way. She's going to become a registered sanitarian. You haven't done that yet, have you? Not yet. She will. She's not been here quite long enough, but soon. So the old guard, we're leaving, and the new ones are taking over. We also do some animal bite investigations. And what we do is anytime someone is bitten by a domestic or wild animal or grazed by them and it tears the skin, we would investigate because that's how warm-blooded animals transfer rabies to humans. And as you know, there's no cure for rabies. If someone contracts it, we must inoculate them or they would get sick and die. So we make sure that we're on that swiftly. And we use environmental people as well as epi people. Stacy Coltus, one of our program managers, really carries that program and makes sure every one of those cases is followed through on. We know if a domestic animal is alive 10 days after the bite, there's no threat of rabies because it would have to be dying of rabies itself to transmit it. But with wild animals, that incubation period varies. So Stacy is our resident expert, and although she doesn't work specifically in Lakewood, she does in times of duress. To give you an idea, we had 65 investigations and 160 events or follow-up that went along with it because sometimes the animal will bite more than one person or we'll have to contact a veterinarian, etc. We regularly sample Clifton Beach. We make sure that the water quality is safe for people to put their face or body underneath, and we give warnings on our website. Kevin, our communications officer, handles that to make sure people know if it's unsafe to swim. We don't want you in the water, we let you know. So if you haven't checked out ccbh.net, especially in the summertime, we do that during the recreational water season. We're just getting out of that, obviously, with it getting colder. But we do those twice a week throughout the entire summer season. We do have phone systems available. We want to encourage you, if there would be an emergency, to always contact our office. We are open Monday through Friday, 8:30 to 4:30, and that's the 216-201-2000 number where you get a live human. There's no crazy phone system. You talk to a live human and they immediately direct you to someone. But even after hours, we have 24/7 capability. And that's required under our emergency preparedness grant. And we do that because not all of public health happens between 8:30 and 4:30. If someone in your family gets grazed by a bat, you're out in your garage one evening and it's dusk and a bat grazes you and it's drawn blood, you need to talk to somebody right now. So we encourage you to call that number with actual emergencies. And the flip side of that coin, you know, Dr. Harris is very modest. He specializes in analyzing systems and making sure they're working to the peak performance. And that's from a monetary standpoint and an expertise standpoint. So he's looking at things like, why do we have a sanitarian who's answering the phone and talking to somebody for an hour and a half about food safety? That's not an emergency. Let's tighten that up, right? Let's tighten up where we use overtime and where we help people. In an actual emergency, yes, as long as you need. But that's not an emergency. So we're really looking at the systems that we have in place to make them tighter, to make sure you're getting the most bang for the dollars that you invest with us. We really appreciate it. And we're very like-minded with the groups you have here. You know, I worked in this city doing watershed protection a while ago on the water team and with the National Children's Study. And I found all these great systems that you have in place. Your YMCA is phenomenal. You're already working with the same systems that we're working for underserved and marginalized populations. The Beck Center, amazing. Not only from the arts perspective, but just engaging folks with all sorts of things and bringing art to them where they're at. And they've invited us. We've come there. We've done food safety demos with chefs. We've done all sorts of interactive things. And, from Three Birds and Bonnie Bell and lots of different businesses in the past that we've collaborated with. And we want to do more of that. And the great thing about having Dr. Harris, who is homegrown, he keeps saying to Kevin and I and to our team, people don't know who we are and what we do. We need to do more of that. And we're really looking forward to doing more community engagement in the future. So I know I ran through the numbers very quickly. We can supply those to you. But if you had any questions about general environmental health for my partners, myself, or Dr. Harris, or even our communication officer, Mr. Brennan, we'd be happy to entertain those.
Wonderful. Colleagues, Councilman Rader.
Thank you. I appreciate that. And this is great. Thank you so much for taking the time to come out here. Director or Commissioner Harris, I know some folks that work for the Board of Health, and they sing your praises. I think it's taking this new direction. The Board of Health has done a phenomenal job, even through the pandemic. It was really difficult. You all soldiered on and really delivered on the promises of your mission. And again, I commend you all for that work. So, like I said, I know some folks at the Board of Health. I know there's an effort to organize the Board of Health. Just wondered how that was going. As a partner, we have a great relationship with all of our unions here, and we know that partnership is really what allows us to deliver the high level of services here at the city. So just give me an update on that, because I haven't heard anything recently.
So as far as our update regarding the unionization, we have, at this point, confirmed what would be included in our, what is it called? The bargaining unit? I'm learning all about this right now. So that has already been determined by the State Employee Relations Board. And the next step is to have a vote. And if our employees decide to vote in favor of a union, we will have an Ask Me union at the department sometime next year.
Thank you for the update. Any idea on timeline on that? Just curious.
No, we have a deadline of this week to review everything that SERP has put together as far as the bargaining unit and making sure that they have the information that they need as far as employees who will be included and titles and things like that. So it's up to SERP to decide when they would actually call a vote, but I'm expecting it to probably be before the end of this year.
Great. Thank you for that update. I do have one other question, if I may. So we've had many of these, and changing gears a little bit here too, many of these wet weather events. We were talking about this out in the hallway a little bit about what that might, how that might change the role even, or increase the amount of work and things that have to be done in order to address things like, I didn't even think about sewer rats being an issue, and all of a sudden that's become a big issue in the community. Are there other areas that you're seeing because of climate change, because of some of these things that are happening in our communities that have kind of been on an unprecedented level, like more frequent, intense storms, things like that, where the Board of Health really needs to change how they do business?
For sure. And, having worked in stormwater for a little bit and watershed protection, we are seeing the infrastructure of some of these older communities. Their systems are gone. They're destroyed. Combined sewer overflow because we've added so many more people, so many more residents, and so many more impervious surfaces. There's just such runoff. And, when we talk to people about pollutants, our minds, a lot of us that haven't worked traditional watershed go to trash, garbage, waste oil, things like that. When we find that erosion is actually the #1 pollutant. And so when we have too much cutting happening, like we'll pick on one big department store. Let's say a big department store comes with a big roof that's impervious and a big driveway that's impervious, and we haven't done remediation. So there's no bioswales, there's no pervious pavement, there's nothing that's there, no ponding, there's nothing put in place to hold water. When it runs off, it's running so quickly off those impervious surfaces that it starts cutting. And it starts wearing down and eroding. And you see it because you used to have a little meandering stream, and now you have a cut, sharp edge, and something that was a foot and a half deep that didn't pose any threats, now 5 feet deep. And a lot of the fallout, not only to the fauna and flora that's there, but also to the actual water quality, it starts choking out things because there's so much soil in there, there's not enough oxygen. So there's a lot of work to be done. We have a very passionate colleague. We were talking over dinner, Robert Brandt, who is very committed to global warming work. And we are starting to collaborate with our community partners because a lot of them are like-minded. So we are going to see more and more positions and more grant dollars, I feel, coming this way to actually address. Just when we say watershed protection, people are like, is that the little hut where I store my garden tools? We're like, no, it's not a shed. Watershed is an area of land that a body of water drains down into. And once we start educating folks about what they can do, and what we'd really like to do in the future with you, if we're able, is start addressing community groups. Start with our seniors. Our seniors motivate people. Grandma, grandpa start telling you how it's got to be. That's how it's got to be, right? And simple things like let's wash our car on our grass, not on our driveway. And let all those soap agents go down and filter through the soil and take less of a load on our storm and combined sewers. Little things like that we can do, and really some impetus, maybe some grant dollars. Dr. Harris is very committed to this, looking forward to projects where we can collaborate with communities and say things like, what can we do with you to help you? How can we engage your people and help you? And we think that we want to be your trusted source for public health information. So when you ask us, can we do a rainbow workshop? Yep, we can. Can we talk to people about recycling and reuse? Yes, we can. We can partner with Solid Waste Management District. Can we talk about stream quality? Yes, and we have partners who can do that at the county level with regional soil and water. So please keep asking. These questions are great. We want to come. We have very knowledgeable staff. Our 2 supervisors in that unit are phenomenal, Nate McConney and Megan Smansky. They'd be happy to come out anytime for you.
Thank you for that. And just thanks again for taking the time tonight, and looking forward to the next 2 years. That gives you an indication how I might vote.
Perfect.
Great. And we are, with that, we are running out of time unless any other colleagues had follow-up questions. I just wanted to comment on talking about being involved in the community. We, as you may know, in Lakewood, we recently passed a climate action plan. We also, with our health needs assessment, have a health needs action plan. So we look forward to taking you up on those offers of collaboration, because I think there's a lot of connection. We also are currently working on an anti-racism action plan. And after this meeting, the very next meeting is our ADA transition plan. So we have a lot of areas, I think, that we can continue to work together.
Thank you for having us.
Yeah, for sure. So, yep, Councilman Bullock.
Hi, everybody. Tom Bullock from City Council for a long time. I just want to acknowledge that I was around when we first, we lost our ability to pay for a health department in-house, and that's when we first contracted with you, probably in 2008. It may have been the 2008 budget year right away, maybe it was 2009, but it's been a wonderful and fruitful partnership for a long time. We always appreciated Terry Allen and his tireless work, and so it's good to continue the partnership. So I appreciate the
Thank you for
robust
saying that.
report and good services and a good relationship going forward. Thanks.
And thank you so much for letting us hire phenomenal employees. We love them. Tom Barsa is absolutely awesome. Jim Armstrong, when he was with us, and your nurse, when she was with us, we got some great colleagues. If you want to push any other great colleagues, we'll take them, right? You guys will absolutely take them.
All right. So I will move to recommend resolution number 2023-44 to full council.
Second.
Motion's been made and seconded. Any discussion? All those in favor?
Aye.
Aye. And that motion passes. And with that, Health and Human Services adjourned. Thank you so much for coming.